Hey there, Lori Lauritsen here with LL Counseling and Wellness, wanting to talk to you a little bit about what I have been affectionately calling a prehab or post-hab integrative intention, or somewhere in the middle. And the reason I coined that term is that there's a lot of people who don't fit the traditional continuum of addiction and trauma treatment. And what that generally looks like is you go to detox if you need it, if you are physically dependent on whatever substances you're using. Then you step down to residential treatment, which is that like 30-day treatment that everybody thinks of when they think of going to rehab. And then you step down to partial hospitalization, where you're living somewhere and then going to treatment. There's different ways of doing that, of course. Intensive outpatient, and then down to outpatient therapy. And all of that is primarily a group-based model. And depending on the treatment that you go to, you might have more individual sessions. You might have 2 or 3 times a week if it's a really good treatment center. But a lot of it is very skills-based. It's very group therapy-based, which is super effective for a lot of people. But there are some people who just don't fit that mold, right? Maybe you know something needs to change, but it doesn't really feel right to go to any of those options, right? Inpatient rehab. But maybe weekly therapy isn't enough, or even a couple times a week. Perhaps you've tried 12-step and either it's not enough to go to any kind of Alcoholics Anonymous or Narcotics Anonymous meetings, or it just doesn't feel right for you. I have a lot of clients who are not necessarily vibing with the 12-step model, although it's very, very effective. And again, like I said, you don't fit that cookie cutter treatment model, but you really want support. And that's where integrative intensives can come in, especially for, again, what I like to call the prehab or post-hab. There's also people who have been to treatment many times and have even created some trauma reactions to treatment, right? That some people call it being institutionalized, or there might have even been some situations that were really uncomfortable in rehab. Now, not that comfort is a part of rehab, but, knowing that there's other options. Maybe group therapy feels overwhelming for you and you really want that more individualized treatment. And maybe you've done PHP or IOP and you want to do something different. The other way that a prehab or post-hab integrative intensive is supportive is if trauma is really what's driving the addiction, right? We can do some trauma treatment and rehab, but it's very short term and it's not as intensive as what the work that we would do together. So maybe this deep wound that you have, or the guilt and shame of your addiction, is what's keeping you in that cycle of sobriety and then falling off and relapsing and staying sober for a while. And there's these deep emotional wounds and challenges, or you really just can't regulate your nervous system. And again, this is where integrative intensives can come in. So it's individualized treatment, and intensive is generally, or at least with me, at least 3 hours. So if you know that intensive outpatient is generally around 9 hours a week of treatment, that's where I looked at that model, and that's why I called it that, is it would be 3 hours for 3 days in a row. And I've done some with clients who were 3 hours for 3 days for 4 weeks and went from having flashbacks and nightmares and not being able to stop drinking because all of those things were so overwhelming for that client, to being sober for several months, and continuing that work and not having the same level of nightmares and flashbacks and things like that. And there's no pressure, no judgment. It's very individualized based on what you need, right? And that might look like using all of the evidence-based tools that I have in my purview. We do mind-body treatment, and that's what makes them holistic and integrated. So we might use tools like EMDR, if you know what that is. It's a deeper level of trauma treatment that doesn't require you to repeat the whole story. Although repeating your story and sharing your story can be a big part of recovery, sometimes we can get stuck in those loops. So EMDR can be really, really powerful. We use somatic therapies like yoga therapy, mindfulness, guided meditation, dialectical behavior therapy, all ways to, again, provide that mind-body connection more than the traditional talk therapy where we're just talking about our stuff, which again can be very helpful. But this is an opportunity to go deeper and learn a little bit more about where that's coming from and shift it more quickly. So, and this is also for people who maybe don't have the time to go all the way into the rehab setting, or just really are looking for something different and more holistic. I could talk about this for a really long time, so I want to give you an opportunity to digest this information, to reach out for a free consultation. And if you're a professional who sees this with your clients, please, I'd love to collaborate, come talk to me, and definitely subscribe to my channel. I look forward to speaking with you. I hope this information was helpful. Thank you so much.